So, Charles, Dr. Mayer, what's a patient to do about these redundant inquiries at the doctor's office regarding one's health status?
Well, I concur. It can be quite frustrating for a patient. Let me explain a couple of reasons why we do it in the first place, and I'll give a couple suggestions what one can do about it. One reason we do it is because we've been trained this way. In a teaching Socratic method here in the hospital and also in the clinic setting, we teach people to ask questions when they're learning, and we expect the questions to go on and on. We even do it in the clinic setting where a medical assistant will ask the same questions that the nurse asks, that the doctor asks. It doesn't make a lot of sense in the clinical setting, usually. Another reason we think it's more efficient. If the medical assistant asks the question, then perhaps the physician doesn't have to ask as many questions. Or if the nurse asks a question, same thing. It doesn't always work out that way. The physician might ask the exact same questions. Another reason is cost. If the medical assistant or the nurse is asking the question, it's possible that the physician can spend more time on diagnosis and on recommending treatment. It doesn't work out that way as well either, always. And finally, it's a triage method. If you come in and you have a terrible problem, it's good for someone to ask you quickly, instead of waiting for a half hour to see the physician, to review what the reason you came in for. You might be triaged in front of the line if it's something severe, or we can get the medications going earlier. Suppose you have shortness of breath, we might want to administer medication to help you breathe while you're waiting for the doctor. So there's a number of reasons. What can a patient do? I recommend, first of all, deciding your approach. If you're the kind of person that doesn't mind telling your story over and over again and enjoy it, then enjoy it and just tell your story over and over again. It's possible that your story will help telling your story repeatedly, because both you and the team might gather more information this way. Another way you could do it is actually just answer the questions in one sentence. So if the question is, what's wrong, what brought you today, you can just answer the question in one sentence. I have abdominal pain, or my eye hurts. Don't go into any detail. Wait till the next person asks you more questions, or wait for them to ask you more. Undoubtedly, the physician's going to ask you a whole bunch more questions. So don't worry, your story will be told. And finally, you can give feedback to the team. If your healthcare team is doing this and you're really frustrated, be sure to let them know. Leave a message. There's often suggestion boxes or methods in order to let the team know that you like your care delivered in a different way. And that's very reasonable.